Hi, I'm Maria Ferris. I am a registered dietitian and a master personal trainer and a corrective exercise specialist and an advanced health and fitness specialist. I am 1 week post-op rotator cuff surgery. I had torn a supraspinatus muscle in my rotator cuff. We think it's just from overuse. I work out a lot. I'm very active around the house cleaning and cooking, and I do my own yard work, and I just think over time it finally went let go. So I had that fixed a week ago, and so I thought I would share my experience for you and give you any tips to help you recover better through this. Um, just help you be better prepared. I did a lot of research before I had my surgery and took a lot of notes, and I found some things definitely help. So I want to share with you everything that I have learned. So, like I said, I'm 1 week post-op today. Today I had my very first PT session, and that went well. She said I got an A plus for range of motion, and this week has been a lot of pain. I won't lie, it's been a lot of pain, especially the first 2 nights until I got a hold of it. My boyfriend, fiance, George, has been staying here with me 24/7 the first week, and I highly recommend that. I could not have done it any other way. He needed to be by my side all the time. So the first night we got home from surgery, and I woke up in excruciating pain. I had only taken one oxy, and apparently that wasn't enough. So we ended up making a call to the aftercares hour, and they said I need to take more like 3. So I was just afraid of taking too much oxy. I don't want to become addicted and all of that. So I was being really minimal. Figured out a pain med schedule using oxy and acetaminophen and ibuprofen that has worked really well. And what my boyfriend did is he wrote down the schedule, what time we were to take it, and then how much. And then over here, he's got a pain chart. So right before taking the medication, he would ask me what level of pain I was in and made note of it, and we adjusted over a couple days. So I won't share with you exactly what I'm doing for pain because I think it's important that you talk with your doctor and your pharmacist. Your situation may be different than mine, but they explained that both the Tylenol, acetaminophen, and ibuprofen spaced out strategically throughout the day could help with that. So I highly recommend that you create yourself a schedule like this and monitor your pain. So this week I was pretty much on the full schedule. Last night we started to cut back on some of the medication. I want to start first by weaning myself off the oxy because I am concerned about taking that for a long period of time. And then I'm going to start tapering off the other meds as well. Okay, so getting on a pain management schedule is really important. The other important aspect is ice. Ice that area 20 minutes at a time and then rest without it for 40 minutes and then alternate that. And we were using a what would you call it, an ice pack that the surgery center gave us, and that deteriorated. So I went to PT today, and they had a really great one that they recommend. So I ordered that from Amazon, and that should be here later today because that invest in a good ice pack because that's going to be really important. The other thing I want to talk to you about is constipation. So whenever you take oxy, that can lead to your bowels slowing down. So they sent home Miralax with me, which is a packet of powder that you add to water. And after 3 days, that still wasn't working. So I talked to my doctor, and he recommended that I add Senna to this regimen as well. And that finally worked, in addition to eating prunes every day too. So I was eating probably a third of a cup of dried prunes every day with a lot of water and high fiber foods like beans, raspberries. Those are two of the foods highest in fiber. Like I said, I'm a dietitian. So a lot of water as well. You need half your ideal body weight in fluids, okay? So that's pain management. Now, I've got the Sling on, And for my surgery, he wants me to wear this for at least 6 weeks. He does not want me to abduct my arm out like this or here. So what you want to think about is having a magazine tucked under your arm and keeping that arm in tightly to your side all the time, either with your sling or just by the use of your arm. But the rotator cuff surgery, there's a high failure rate. So in order to avoid that, you want to follow instructions perfectly, and that includes wearing your sling religiously like they want you to. I think the only time they want me out of the sling is to take a shower. And even, with the shower, I'm putting myself in a second sling that I can let wet and then, air dry for 24 hours. So wear that sling, and then also PT is important too. So today we just did passive range of motion, where she just moved my arm in the appropriate directions and then taught me how to do that as well. What else has been helpful? The 24-hour care for at least 7 days. You're going to need someone constantly to give you your meds, to go get ice for you, to help with. I've got 2 dogs sitting on my lap currently, and so I've got 2 little dogs to let them out, to bring me food, to take care of the household duties. I felt like doing nothing. I felt so sleepy. I couldn't even read. I'd pick up a book and start reading for 5 minutes, and I'd fall asleep. Also having a bedside tray table. So a friend of mine let me borrow hers, but I've got a list of Amazon items, and I'll link the bedside table and all these other items I'm talking about as well. But it's a bedside table that actually adjusts, so you can get some incline. So I was able to do some work with it at an incline. But it's also helpful to have like your lip balm, all your medications, water, also some little apple sauces like this, and little puddings we keep up on the bedside table with water and a spoon, because you will want to take a small amount of food whenever you're taking your medications. We kept my phone up there, my glasses, the phone number of the doctors, and then the aftercare should go up there too. Also, some other items that I think is really important to have that I have listed on my Amazon blog that I'll share with you later. Things like these soft picks. You won't be able to use your arm to floss your teeth. And then as you can see, I've got braces, so I can't floss really well anyway. So these are working really well. A recliner. So I bought a recliner at Costco because you can recline it back and then with the aid of pillows get in a pretty comfortable position, because sleeping is difficult, especially the first week. So I've been kind of going back and forth between that recliner and then the bed with lots of pillows to sleep. I've also found a lap tray to be really helpful, and it looks like a tray, but it has a pillow on one side, so I'll link to that. But that has been helpful when I'm trying to do some reading or some work in bed. I can just put that on my lap. A lot of small pillows. There's one travel pillow that I have that is perfect because you can maneuver it in different positions to get just the right angle for what you want it for. And like you mentioned before, a quality ice pack. The one they gave me fell apart, and then we were using Ziploc bags, and guess what? Those get holes. I woke up this morning completely soaking wet. So I'll link that wonderful cold pack that my PT loves. A quality sling. This is the one that they gave me from the hospital, and it's just terrible and is not working well. So I just got this in the mail today from Amazon, a really good quality, nice sling. And then you'll want to get some loose sleeved, loose fitting clothes that your arm can go into. And someone gave me the Suzanne Summers 3-way shirt. It's like you use it as a poncho, or I don't even know what it does, but it is so loose and so thin and so soft. It is perfect. So I like to put that on top of the sling. Sometimes the material of certain shirts bother me, the sling bothers me because of this material, and it's kind of pokey, and so I like to wear it outside of shirts. So you want both things that fit over the sling and then tight things that fit under your sling, yet loose enough that you can get your arm into. And it's another reason why to have someone around 24/7, you need help getting dressed. You need help in the shower too. So what we've been doing is he's been getting in the shower first and doing his shower, and then I get in after he's done, and I've got my sling on already, my shower sling ready to go, and then he washes my hair, and I try to do the rest of my body best I can. And then to dry, I can't dry very well with one arm, so he's been helping with drying as well. So let's see, what else has it been like this week? Stayed in all week. Didn't feel like leaving the house at all. Today's the first day I've even had makeup on. Oh, and hair. So I was worried about doing my hair because this is a straight hairstyle that needs this brush and the blow dryer at the same time. And so George was gone most of yesterday. So after I took my shower, he left. And I thought, oh, I can blow dry my hair by myself. And I'm like, I can't. So what I did is I actually laid the hair dryer down flat on the counter in the bathroom and positioned it so it wouldn't then move. And then I got down on my knees and I'm using the brush, but I've got my head in the air. It actually turned out pretty well. I'm pleased. I was thinking it was going to have to be baseball hat hair for the next 6 weeks. Doing a lot of sleeping, very low energy. Like I said, I can't even read. I last just a few minutes and then I just have to close my eyes. Icing a lot. I definitely could not have worked this week. So, plan on that post-surgery at least a week. I'll see how next week goes and we'll see. But I've told all my clients, my personal training clients, there's no way I'm going to see you for 2 weeks. And then after that, I'm probably just going to be sitting in a recliner, barking orders at you, guiding you through those workouts. Okay, some other notes for you. Questions to ask your doctor. So we got home and we're like, what are we supposed to do? We felt like we didn't have enough of those details. So ask your doctor for details about the medication and ask them about pain control that's beyond oxycodone. So say I want to take the oxy, of course, but also the acetaminophen and the ibuprofen. Can you give me the dosing schedule? And also find out the maximum amounts, because some of these anti-inflammatories you do not want to take more than like 3,000 milligrams a day. So find out what they want you to do exactly. And then also, what movements can you do and not do? Like I said, it's important not to do this abduction movement, but what else are you allowed to do or not to do? Also, when can you remove those surgical bandages? I had a big one covering the little incisions. They did arthroscopic. And so he said, leave that on for 1 day, pulled that off, and then I had these other pieces of tape that were like crisscross. He said, let those fall off by themselves. They finally just got so yucky and gooey, I pulled them off myself. So ask about that, and then ask when you can shower and how wet you can get it. So those are my questions. Everything else I felt they had answered adequately post-surgery. Okay. I'm a big prep ahead person because I found that if you prep ahead, it eliminates stress later. So I made a list of all the things I absolutely wanted to have done before surgery day. So what I did is I cleaned out my pantry, just kind of got organized so I knew what was in there, and then I bought things that I needed. Like, we are fully stocked up on paper products for the next 3 months. I have canned items and dry good items that I can make easy to prepare foods at a moment's notice. I did the same thing with the freezer. I pulled everything out of the freezer and I used up some things that were getting a little old, and then I reorganized and I went to the store and I bought frozen items that we could use for minimally prep food. Like, I've got some frozen fruit, frozen veggies, I've got some frozen chicken, frozen shrimp, scallops, and salmon in there ready to go. So those are all easy to prep. I Also made sure the house was 100% clean. I did a really, really good job, and I hired a housekeeper. So I've got her coming at about week 2.5 post-surgery. Figure we can get through that. I also washed my car inside and out. The dogs went to the groomer and went to the vet, so they're all set for a while. I paid all my bills. I scheduled the housekeeper. I scheduled all of my physical therapy sessions and all my post-op doctor sessions. And I scheduled friends to take me to those. I'm trying not to rely too much on George. I don't want him to get too burned out. So friends have been asking what they can do. I'm like, you could help me drive to PT sessions. I shopped and stocked up on just anything that I needed whatsoever. And I also pre-shopped Amazon for items that I need for recovery. You're going to need like a lot of ibuprofen. I stocked up on that ahead of time. Like I said, I made sure I had all of these ahead of time, and my soft picks and some of my hard goods like that bedside table and the lap desk, things like that. So anyway, it's going pretty well though. It's not as bad as what I expected. The pain was a little surprise. It was bad, but we got that dialed in really fast. So it's progress. It's a process rather, and you'll make progress with your process. You'll get through it. It's really not as bad as I thought. It's funny how I was worried about just having the use of one arm. It's amazing what I can do with my left hand now. It's really shocking. So it's all going to work out just fine. Don't worry about it. Check back. I'm going to do another video blog in about a week. So I have some more tips for you too. And don't forget to check out my blog where I have that list of recommended items to shop for and get ahead of time so that you're all set. Okay? All right. Take care. Bye.